detail. So let's start with Tony. He's a 76-year-old man who's a regular patient of yours. He recently suffered an L2 compression fracture and now has come to see you for the results of his dual energy X-ray absorptiometry or DEXA scan. He is a non-smoker and takes ramipril 5 milligrams for hypertension. He has no allergies. And then, mind my very dodgy Photoshop effort, there's some results of his DEXA scan. You can see that his T score for the lumbar spine is minus 3.6 and the left femoral is minus 2.2. So let's just look at the key information in that scenario. So 76 male, he's had back pain, several weeks probably could be significant too. He's got a known L2 compression fracture and he's a non-smoker. He's on ramipril for hypertension rather than for another indication, and he's got no allergies. Obviously then the key information in the picture there is the T-score. So question 1 could be something like, what are the underlying causes for this pathology? Give 6. Question 2, you've successfully treated his pain. What other classes of medication would you use to treat this patient? So this was taken from, I think most of these questions actually were from 2018 exams. And I think this question probably had another third part, but I couldn't really decipher what it was from the exam report. Excellent. So question 1. So for that one, it says give 6, so you'll be given 6 boxes. And for question 2, you'll be given 3 boxes. So let's just have a look at question 1. So say if you wanted to give some causes, you think of his weight, steroid use, alcohol use, lifestyle factors, smoking, and kidney disease. So I've probably gone a bit overboard with making these answers not very great, but I just wanted to highlight the examples. So what's wrong with this answer? Weight. You need to be specific and imply overweight and underweight. And probably one step further, you need to maybe specify what underweight is. So give a BMI that may correlate with being underweight. Steroids is correct, but it probably wouldn't score you any points because intranasal or inhaled steroids aren't shown to cause osteoporosis. It's specifically over 3-month use of oral steroids. Alcohol use, and this was commented in the exam report that lots of people put alcohol use but didn't specify how much. So having a drink a couple of times a week doesn't increase your risk of osteoporosis. And I don't know the exact dose that does, but you could say, drinking above the safe limit of 2 standard drinks a day on more than 5 days a week could put you at risk of osteoporosis. And lifestyle factors, should just remember this now, you should never answer that in a KFP question unless you literally can think of nothing else to write. And even then, you probably won't score points because what lifestyle factors are you looking at? Is that the alcohol, which you've already mentioned? Is that smoking? Is that lack of exercise? Is that too much exercise? Is that fatty diet? There's so many things that can encompass, and it doesn't show that you have any knowledge of the relationship of any lifestyle factors to osteoporosis. It's just not really ever going to score you points. And as I mentioned earlier, not taking into account the STEM. So in this question, the patient is a non-smoker, so you can't write smoking. Although it does cause osteoporosis, you have to, and the question says what are the underlying causes for this pathology, which is implying osteoporosis. You have to assume that you're talking about the patient in the question. And then kidney disease. So chronic kidney disease, yes, definitely, stage 4 and 5 definitely causes osteoporosis, but, renal stones or, I don't know, recurrent UTIs, I don't think is a risk factor for osteoporosis. So let's look at this question again, if we try to answer a little bit more specifically. Oh, sorry, questions just come through. Here, alcohol abuse, would that be enough? Possibly, but I think it's probably better to specify, because even alcohol abuse, like you could say abuse is binge drinking 30 cans of beer one day on the weekend and, once a month, I'd still say that's an abuse of alcohol, but I wouldn't say that puts you at risk of osteoporosis. So I think it's chronic excessive use of alcohol. You could write that. But I think if you know the answer, like we all know that the safe limit is 2 standard drinks a day for men, no more than, on 5 days a week. So just write that, or put something else down. There's plenty of options in this question. All right, so if we've been a little bit more specific, underweight, that probably would score you points. Prednisolone use for greater than 3 months, excellent. Vitamin D and calcium deficiency, excellent. Inflammatory bowel disease such as Crohn's or ulcerative colitis. Hypothyroidism, and we've got the chronic now in kidney or liver disease. So let's just have a look at what's wrong with that answer, and I think you probably all know where I'm going if you've done any of the ESO modules. So this question, although we've been nice and specific, we've actually got too many answers, which are highlighted in blue. So the question said give 6, and we've actually given 1, 2, 3, 4, 5, 6, 7, 8. And that's an example of overcoding. So the answers are definitely all correct, but you're only going to score points for the first 6 listed there, and then you're going to score negative points for adding 2 extra answers in. And I'll explain a little bit more about why overcoding, although overcoding in itself is actually a relatively infrequent problem in the exam, according to, well, I think the exam prep course I went to, they talked about it. It's often what people worry about a lot, but it actually doesn't happen that often. But the problem with overcoding is then you lose points because you've often grouped answers as well, which I'll talk about a little bit more. So here, I can't remember the exact figures. I think it is on the ESO module, but I forgot to check. In this case, because you've given 2 extra answers, I think you still get some answers right, the ones that are right, and the ones that you haven't grouped. And then you lose like a 0.2 or a 0.15 or something for every extra answer. And that gets taken off your total for the question. I hope we're keeping up so far. I think I have one more example there. Oh, sorry, I'm just losing track of myself. Yeah, here we go. Sorry, we'll do a question break after this one. So say if we didn't want to overcode our answers, so we've cut these 8 answers down to only 6 answers. So we've got vitamin D deficiency, calcium deficiency, Crohn's disease, ulcerative colitis, kidney disease, chronic kidney disease, and chronic liver disease. And again, this is a very obvious example of grouping. So for this question, although you've got 6 correct answers, you're actually only going to score 3 points because vitamin D deficiency and calcium deficiency are too similar. So I think this is probably my biggest beef with the KFP exam, because that's probably the technique that you have to get used to the most. I think people worry the most about putting too many answers, but actually I think we need to focus more on trying to not put too many similar answers. So ulcerative colitis and Crohn's disease is essentially the same thing. And I think in this example, I know I've said be specific. I think if you put inflammatory bowel disease, you probably get a point, but it's okay also to put Crohn's disease or ulcerative colitis, just don't put both. And then chronic kidney and liver disease are also too similar. So then if we go back to that example of overcoding, you can see here that, say if we take the first 6 answers are the ones that they will count as an answer. So in this case, it'd be underweight, prednisolone use, vitamin D and calcium, and Crohn's and ulcerative colitis. Ulcerative and hypothyroidism. So the 2 that they wouldn't give you any marks for a kidney or liver disease because they're the overcoded ones. And they just take them in order that you've written them on the sheet. So you'd think that you might get 6 points for this answer minus the, would it be 0.4 or 0.3 or something for the overcoding? But actually, because vitamin D and calcium deficiency are a grouped answer, and Crohn's and ulcerative colitis are a grouped answer, you'd only actually get points for underweight, prednisolone, vitamin D, ulcerative colitis, and hypothyroidism. So it's that 1, 2, 3, 4, 5. So you'd actually only get 5, and then you'd minus some marks for the overcoded examples. So I think that's where people fall down. I don't think putting too many answers necessarily is the problem. It's that then the answers that they've given beforehand are counted and they're grouped. I hope that makes sense so far. And we've just got another question in the chat box there about the question does ask, as I said, what are the underlying causes for this pathology? And I think that the question should just be worded, what are the underlying causes for this pathology in this patient? And I think that's probably where most of us got frustrated in the KFP course I attended with RSEGP, that we felt that we were answering the question by saying smoking is a cause of osteoporosis. And the question is asking what are the causes of osteoporosis, but you have to keep your answers specific to that patient. And at the end of the day, like if you could only think of 5 answers in the exam setting, you're not going to lose marks for putting smoking as your 6th answer. You're just not going to score points. So if you're not sure or you can't think of an answer, then it's okay to put something that you know might not score you any points, as long as you've just checked that you haven't got too many answers. So the only way you score negative marks is for overcoding. You don't score negative marks for grouping, and you don't score negative marks for answers that don't take into account the information in the stem. And also you don't get negative marks for not being specific, but I guess sometimes you just don't get any marks at all. So that first example I gave, the very obvious one at the top, most of those answers there, so you're actually probably not going to get any answers, any points for that question, because none of your answers have actually showed that you know what the risk factors for osteoporosis are. So I'll go through a few more examples. I've got quite a few here, and we'll see how we go for time. Some of them are more obvious than others, so we'll just see. Oh, sorry, and then the end of this question was, you've successfully treated his pain. What other classes of medication would you use to treat this patient? And then obviously I've given 4 answers there, and you wouldn't be able to because you've only been given 3 boxes. But I just thought I'd highlight this question because it wasn't answered very well according to the exam report. So calcium and vitamin D, that answer is technically correct, but it's not a class of medication. So you might have to put something like dietary supplements or vitamin supplements, because they're not asking what medications you would give, they're asking what classes. And then lifestyle changes obviously is not a medication, and I just put that in there to highlight that you've got to answer the question. Bisphosphonates would be correct, and SERM stands for selective estrogen reuptake modulators, I think SERM stands for, is definitely a correct answer for treatment of osteoporosis, but this patient is a male, so you wouldn't be able to give it. And I think that's what they wrote in the exam report, so I highlighted it, is that 10% of candidates put raloxifene as an answer, when 1, it's not even a class of medication, and 2, it's not suitable. So this question, I think I probably would have put something like vitamin supplements, bisphosphonates, and I guess you could say hormone therapy, because like low testosterone would be a risk factor. Otherwise, I can't really think of the third one, and it didn't unfortunately say in the exam report. If anyone can think of a third one for a male, then please let me know. Excellent. So we'll go through, as I said, a few more examples, but just to kind of summarize now in case some of you have to drop off when we're not finished the examples. Excuse me, overcoding. If you are using a comma, the word and, the word or, then just think twice because you may be giving multiple answers. With grouping, the way I think of it is if it answers the same, if the answer covers the same body system, the same class of medication, or say a referral to the same group of type of people, like, refer to physio, refer to OT, refer to exercise physiologist, then you're definitely grouping. So if you're answering the question about what is a differential diagnosis for, a 3-year-old with a fever and a cough, let's say a 3-year-old with a fever, if you put like pneumonia, bronchiolitis, croup, yeah, they're definitely all correct, but you're just showing differential diagnosis for respiratory infections in children. You've got to take your answers more broad than that. You've got to say, acute otitis media, septic arthritis, appendicitis, urinary tract infection, like that. There's multiple answers, and just think to yourself, am I in the same body system? Is this answer too similar? And then, as I said, like if you're referring someone with joint pain to both the orthopedic surgeon and the rheumatologist, it doesn't really show that you know how to manage that particular patient. It just shows that you know there's two different types of specialists that could manage it. And especially, I think more so with allied health, you know, if someone's got chronic back pain, you don't need to refer them to the physio and the exercise physiologist and the OT. You need to think of some more creative answers of how you would manage back pain. And it is hard because the answers are definitely correct, but they want you to display your knowledge. But they want you to display your knowledge without answering too many times. So I think it's a bit complicated. And try not to get too caught up on it when you are doing the practice exam or are doing the real exam, but just sort of keep those points in the back of your mind. And then I guess non-specific, some examples would be review, reassure, RICE, simple analgesia, rest, or educate. And like they're all things you might write in your patient file, like, you know, came in with that discoloration to the nail, reassured. But I guess in the KFP, you've got to say why you reassured them. So to explain that you understand what the condition is. And same with review. Review is a great answer, but you need to give a time frame. So they've got acute otitis media and you're not going to give them antibiotics. So review in 2 days, I think the guideline says, or you're giving someone with chronic suppurative otitis media ear drops, review at 7 days, or if you're giving them antibiotics, review at 7 days. If it's a mental health condition and you're starting an antidepressant, then review at 2 weeks or review at 4 weeks. So it's fine to review them, just say when. Never say simple analgesia. Put paracetamol, put ibuprofen, just don't write simple analgesia. Because you wouldn't say that to the patient. You wouldn't say, oh, have some simple analgesia. You'll say, take some Panadol, take some Nurofen. And then rest is fine, but you need to be specific. So if they've got back pain, do you want them to rest for 4 weeks in bed? Do you want them to rest for 1 or 2 days? Do you want them to rest from heavy lifting? What are you resting them from? And sorry to just repeat myself over and over, but educate is the same. So what are you educating the patient about? Are you know, and I don't think even writing educate about the condition, like I think you could say educate that the condition is benign, or educate that it will resolve in 3 to 4 weeks. But educate will never score your points on the phone. And same with RICE. Like lots of people would argue that if you put that in an answer for management, you're actually giving 4 management advice. So you're resting, you're icing, you're compressing, and you're elevating. So not only are you giving 4 answers in one, so you may be at risk of overcoding, you're kind of grouping as well. So, you know, just write, give an ice pack if it's a sporting injury. Like, if you've written that, the examiners will likely know that you know RICE exists, but it's just better to be specific.